Welcome everyone. I'm Councillor Matthew Winnington, Encampment Member for Community Wellbeing, Health and Care. Just some housekeeping first, just a reminder of the continuous fire alarm sounds. Please evacuate the room, there's no one in the public gallery, by the stairwells. Do not attempt to use the lifts. Please assemble by Queen Victoria's statue in Guildhall Square. Don't think anyone would have signed in today, so that's fine. There's no members of press or public here. Just a reminder, please can everyone use the microphones and remember to switch them off when they have finished. So if we start introductions then from my left.
Anna Martin, Democratic Services.
Councillor Graham Heaney, Labour Group Spokesman for Community Wellbeing and Social Care.
Andy Biddle, Director of Adult Social Care.
Emma Baxter, Finance Manager.
Brian Madgwick, Independent Councillor for Paulsgrove and Member of this committee.
Thank you very much everyone, and a special welcome to Emma in her first meeting as taking on the mantle of our financial guru for Community Wellbeing, Health and Care. A great responsibility, but I'm sure you'll settle in very quickly. So we have no deputation requests. We do not have an apology for absence, but Councillor Lewis Gosling is not yet present. I'm sure he's probably delayed with work or some such. Members, any declarations of interest? No. Okay, so we move on to item number 3, integrated working between Portsmouth City Council and the Hampshire and Isle of Wight Integrated Care Board. Over to you, Andy.
Thank you, Chair. So the purpose of the paper is to update members as to the current working relationship between Portsmouth City Council and Hampshire and Isle of Wight Integrated Care Board. Under section 3, labelled background, the section details the history of integrated working between the Council and the NHS in Portsmouth, both from a commissioning perspective and from the perspective of provision of services directly through the NHS Provider Trust. The work has been focused on outcomes for residents in areas such as the quality of care, helping people achieve timely hospital discharge, care and health in the community, and working to help residents maintain good mental health. The section 3 also reminds of some of the health and quality of life challenges that there are for Portsmouth residents in the infographic. Under section 4, the current context, that section sets out some of the challenges that the ICB has been managing over the last 12 months and the impact that's had on local working in Portsmouth. And then finally in section 5, talking about the interim memorandum of understanding between the Council and the ICB, that section sets out the arrangements in place for leadership and support in Portsmouth, whilst the ICB conducts a formal restructure. The review timeframe of that MOU is also listed and the arrangements which it covers. That's a brief summary of the paper, but as always, happy to take any questions.
Thank you very much, Andy. Helen, would you like to introduce yourself, and then perhaps if you'd like to go into a bit more depth on section 5?
On the MOU?
Yeah, on the MOU.
Yeah. I'm Helen Atkinson. Apologies, Chair, that I'm late. I'm the Director of Public Health and currently also Chair of the Health and Care Portsmouth Partnership, so leaning into the ICB. So obviously take the paper as read. In terms of the Memorandum of Understanding, in November when Jo York left, who was the Managing Director for Health and Care Portsmouth, so she was the lead, but she was the ICB Place Managing Director for Hampshire and Isle of Wight ICB. And because the organisation was about to go into a consultation process, they had a staff freeze at the time. So we were asked if we would support, so that's Portsmouth City Council were asked if we would support the Portsmouth Place for the ICB. So that meant it wasn't just me, I should say, it was a team approach. So that was myself as stepping into the chair of the Health and Care Portsmouth Partnership role, but also then working closely and being the conduit into the commissioning round, because obviously at that stage, November, December, we were already well into our financial planning year for the 24-25 period, but the NHS hadn't started yet, so it was really to be the conduit in to sort of ensure that we could continue with the partnership approach, integrated approach through Health and Care Portsmouth, so ensuring that Andy had the financial decision making and commissioning lead around adults, and that Hayden Gins, on behalf of Sarah Daly, had the financial decision making and commissioning place at the commissioning table for children's. So it was really just to really try, whilst the ICB were in a what's the word that I should use? State of flux, Andy?
Restructure, I think, probably.
Yeah. And obviously, still, just to say, it's an important point, but the NHS nationally is still waiting the planning guidance. So it's very difficult at this point in time for the ICB to be making all the final decisions for next financial year. So that was the arrangement. It was on an interim basis. We put a review in for the end of February, which we went through and agreed that we would continue until the end of the restructuring or consultation for staff, which starts on Thursday this week and will end in 6 weeks. It's 10 weeks, isn't it? It's 10 to 12 weeks. So I think it's the beginning. I think it's the beginning of May. So that work continues, and it's really to try and ensure that we can stay as we have been, although that is fast changing, but as we have been for Health and Care Portsmouth since its inception in 2015. And the main bit Andy's already covered, which is it's very difficult to do that when you've got when you're part of a larger NHS organisation. Is there anything? I'm happy to answer any questions, but that arrangement will continue until we come out of the restructuring process, and then there's the opportunity for all of us in the team, so Hayden, myself, Sarah, Simon, Andy, to feed in to what it could look like post-restructure. And of course, also just to mention, Alan is in the Deputy Managing Director post, so she's there, but she's an NHS employee.
Thank you very much, Andy and Helen. Any comments or questions, members? Graham?
I suppose a comment, really. I mean, I think the report is fine as it is. It's reporting the situation as it is. But we did actually take some time at the Health Wellbeing Scrutiny Panel to ask a number of detailed questions about what was going on. Quite a few detailed questions from different members about what was happening to the budget, planning guidance, etc. And obviously the situation is difficult because the NHS apparently hasn't got planning guidance available, so therefore they can't make their budget. So they're going to be, and I was querying, how many months into the new financial year we're going to be before they can really finalise budgets, and no one could be absolutely clear. I speculated on maybe 2 or possibly 3 months, but didn't get a really firm answer to that one. We also asked questions, I think other members asked questions about the role of how the new board will deal with commissioning and whether they're going to take account of the nature of different places, i.e. big urban communities against rural communities, etc., but also the issues of deprivation, etc. And whilst the paperwork suggested, the word suggested they would, I couldn't be absolutely clear that we would get that level of support, I suppose, through the process, because it looked like they were looking to have it as a very centralised process, with a sort of barely even provision of services. I mean, ironically, we got a copy of a report that was supposed to have gone to the Wellbeing Scrutiny Panel about the stroke recovery service, but it didn't arrive in my email box until 12 minutes past 4 on the day of the meeting. Now, I'm not quite sure where it got to, but it wasn't tabled. I've asked some questions. I don't quite know where it is, but it does say some interesting things. And it does actually have a really interesting table at the back showing how uneven stroke recovery services are across the whole of Hampshire, showing that certain standards which are expected from a national perspective on recovery, stroke recovery, are not met in different places. And that obviously is not good for people, because obviously you shouldn't really rely on services by the luck of where you happen to live. But also it presents a real challenge to the ICB about how are they going to make sure that services are equitable. One option would be to level them down, which would be really, really unfortunate for lots of people, rather than levelling them up to the best. And we don't really know at the moment where that's going to go. It's a pity that we hadn't had that paper at the time, because I would certainly wanted to ask some more detailed questions about it. But we weren't able to because it wasn't apparently tabled at the meeting. I mean, I think this is something that we need to keep on to the ICB about, to really make sure that they recognise the difficulties that it's going to cause for Portsmouth, given that we've had a very good relationship with health and care across the city, and we don't want to lose that. That's important for the people who get the services. So it's looking rather grim, to be quite honest. And I hope we can have some more regular report backs as time goes on about where this is going. And as a member of the Health Wellbeing Scrutiny Panel, I'm always willing to be of assistance if I can, in terms of asking questions when we do get people from the ICB coming to talk to us. If there are some questions that would be helpful to be asked, I'm more than willing to do that. I did ask a couple of questions following a briefing. One of them related to new initiatives and how new initiatives are handled, but I couldn't get an answer at the time because nobody knew the answer. It was a detailed question, but I'm hoping that we can get some feedback on that one as soon as possible. So I think that's all really I want to say.
Thank you, Graham, and I'd like to thank the members, all members of the Health Overview and Scrutiny Panel for their what I understand was quite a probing session last Thursday, and indeed I think is one of those important aspects as has come out in the standards, the terms of reference for the integrated care partnership. Part of the terms of reference was that the HOSPs, the Health Overview and Scrutiny Panels, are the designated scrutiny functions for the Integrated Care Board, which I think I know our HOSP is certainly doing their job. When, as Graham said, we can actually get the right people from the ICB, ICB Central, to actually come and be questioned and be held to account. Something that has historically been quite difficult. So the fact that we did have, I think it was Martin who came from the ICB. No, not Martin. Who was it? Who? We had Dan. Okay, so we had Dan there. Was useful having someone we could actually go to who's at that central, rather than it being subcontracted effectively to our local team, who of course do not have the responsibilities, because the responsibilities ultimately lie with that senior leadership at board level. So yeah, I'd like to thank the HOSP, and just to sort of put this in wider context, it's very much a case of, at the moment, we're doing almost a multi-pronged approach to relationship with the Integrated Care Board. So the HOSP was one of those, because they have that statutory function of scrutiny. We have the myself in some positions where it's just me, others where we've got Andy as well in terms of the Integrated Care Partnership. We've got Helen, who's working within the wider system as well, taking leads on certain aspects of the work that we're doing across that. And obviously in this current role, which is a interim arrangement, that we've actually got some leadership locally, because effectively when Joe York left, if we didn't put this in place, then we would have had no local place-based leadership. Added to that, so I responded to a letter that was sent to the political chairs of the Health and Wellbeing Boards, asking about how is the Integrated Care Board helping you meet your aspirations in your health and wellbeing strategy. So this was the same questions that I had last year. This is a standard thing that we get. And my response was quite similar to last year, but it was somewhat different in that I really brought up the fact about everything is about place and prevention. And what you don't see, we see a lot of warm words in terms of we think Health and Care Portsmouth is wonderful, and we do get this from the Integrated Care Board leadership, but what we don't see is actually actions, and I said that in very uncompromising terms. And I do know also from the Chief Executive, and again, this is the Chief Executive has a role here in terms of a lot of those funding issues and the lack of clarity over funding, which Graham has alluded to. Connected to that, we are currently looking to put together a response from all Health and Wellbeing Boards, all Cabinet members from the 4 authorities in Hampshire, Isle of Wight, full upper tier, the Chief Executives and the leaders to do basically a how can we help the Integrated Care Boards work better. Not in a financial way, we're not going to throw them loads of money because we don't have any, but how can we actually make that system work better? And that's something where we're working very, very closely with our other upper tier authority partners. And indeed, I'd like to thank my counterparts on Hampshire, Isle of Wight and Southampton for the way that we have continued to work together as with one voice on this, because we all want place-based solutions for what we're doing. We all want as much integration as possible, and we all want the very best for our residents, which those two things will deliver. That message hasn't yet sunk in a practical way at top level. However, I would say as well, last Wednesday we had the Health and Care Portsmouth Partnership Board, which is the successor to our old integrated commissioning boards that we had under when there was a clinical commissioning group, and we did have a non-executive director from the ICB who attended online, and she was very, very complimentary about what we're doing, but also I think is someone who can really push that agenda at an integrated care board level. So the message is getting through. And then just to finalise is about the motion we've got coming to full council next week. I know this is it's been put forward by myself and Mark as cabinet member and chair of the Health Hosp, but it is very much about sort of crystallising that cross-authority, cross-party working. I always stress we're 4 authorities run by 4 different parties, independent, Conservative, Labour and Lib Dem across that, yet we all come together on this. And I hope obviously tomorrow that we'll be able to, losing track of time there, tomorrow we'll be able to put that forwards and come together and sort of say Portsmouth is on there. Because what we need to show as well, it's not just one party doing this in one place and one party doing it in another. We are coming as a city saying we believe this, but we're also doing it in partnership with our other local authorities, because we all want that. We know that that's the best way to deliver things and doing that. But this paper is very much about this is a marker for us to say this is where we are now. These are the difficulties that have been going on over the last 18 months or so since the integrated care system became formal. These are the concerns that we have and the difficulties that we're having, but it's also for us to then go, this is not ideal, and there's ways this can be done better. And I'm sure all of us will continue to do that. And I can absolutely agree with Graham that this just goes on. We can't afford to stop, because if we let things go, if we just sort of give up and everything becomes centralised and everything becomes bogged down in endless, it's all about the money, then we're going to end up with very poor services. And we have to try and make the Integrated Care Board's leadership aware when they're making decisions that are ultimately not the best for our residents, but also are actually going to cost the system more money. And I think that was one of the questions that was asked last week. Certainly it was asked, it was brought up at the Partnership Board. And it is something we constantly say, if you take money away from this, you're going to cost more money here. And I know certainly the partnership board, our representative from the hospital is QA is getting incredibly frustrated. They are getting so frustrated there by money going away from preventing people going to hospital, because they know then it's going to cost more money in hospital to treat them, and then it's going to cost us more money when they come out of hospital because they'll need more care. Whereas if you stop them going into hospital in the first place, you save a lot of money. You don't have to spend it. So it's all just about, rather than being completely focused on those issues, and the stroke service is exactly one of those, as Graham has pointed out. There's a poor or non-existent service in part of Hampshire, Isle of Wight. We have one in Portsmouth. It fits all of those pathways that you're supposed to do. Therefore, that really should be the model to use, or a very similar model. But the fear is that it could be, we'll race to the bottom, and then also where's the real where's central government and NHS England really holding people to account? Because it's going to be up to us to hold them to account. Us in Portsmouth, Southampton, Hampshire and the Isle of Wight, with our hosps and with our members and with our residents as well. So it's an important paper because it tells us where we are. We're in a very difficult situation, but we still do have huge amounts of integration. We have locally massive amounts of will to make this integration work, because we know it's the best for our residents. But we are also working consistently with our partners, both within the city and outside the city, to try and make sure that what we have continues. Just a question on the MOU, and I know you mentioned it briefly, Helen. Obviously, in the paper, we're talking about end of February. You said end of April. You said start of May. Do you have any inkling about what things might look like when they finish their restructure? Have we been given any ideas at all at the moment?
No, I'm afraid not, no. What we do know, unless Andy wants to add, what we do know is that there has to be a 30% reduction in staffing across the whole organisation, and that the organisation intend to have a matrix model where functions will be centralised, and we've started to see that already. So, for instance, primary care contracting will be in a central team, but that there will still be posts who will have a matrix into local place. What we've been told is that places, this is a good, although I've not seen this in writing, this is a good thing in that places will be, could look different. So it won't be one size fits all. So it will be based on level of need in those local authority place-based areas. I say local, but they are place-based, NHS and local government. And of course that makes sense because obviously we've got a large county council, which is two-tier. We've got two deprived coastal cities, and then we've got an island. So actually services and needs are different in each of those areas. So that is promising, but no information until post, obviously, the consultation. And in fairness, it is a staff consultation, therefore they have the opportunity, and we will have the opportunity as Health and Care Portsmouth to feed back. But I believe we will see the plans will be published on Friday. It's Thursday, but I haven't seen anything, no.
Thank you, Helen. I think that's really helpful for us to understand where things are going. And again, that's one of the aspects that we've been talking about with partners across Hampshire, Isle of Wight, is very much about the fact that there are different needs in different places. Obviously, a need in Isle of Wight is very different from a need in for example, Winchester, and with those real different aspects. And of course, in the Isle of Wight, they have their own, rural poverty, which you don't get too much of in Hampshire at all, but they have quite a lot of it. And then, of course, huge amounts of sort of holiday area, very elderly population, where, of course, places in the Isle of Wight, in Hampshire and New Forest in particular, for example, they do have, on Hayling Island. They do have. So it's some really interesting work, and I think one of our things is how we can learn together, but also how we can keep making sure that things are done in a way, and ultimately that local authorities do not get forgotten, because too often things have happened and we have been forgotten. So which is the most frustrating thing, when you just get one example was this isn't the ICB directly, but this is a NHS thing, was about the new proposed hospital in Basingstoke, which will replace the current hospital in Basingstoke and the hospital in Winchester. It's certainly in terms of the A&E, etc. And they forgot to, or they didn't speak to the local authorities until very, very late. And it just had landed there. And they did not contact Portsmouth or Southampton, bearing in mind, because of where the new hospital will be, you will get some people who will instead go to Southampton General, to QA, and even to Frimley as well, because of the nature of where those are. They didn't even consider what the consequences of that would be. And that's just the kind of thing that we just have to try and get them thinking a lot more about. What impact does that have on communities and on what people are doing? So I hope that report's been useful for everyone. And thank you so much to Andy and Helen for putting it together and presenting it today. And that concludes the decision meetings for this municipal year. Thank you very much, everyone.
I did actually have one question I put my hand up for, didn't I?
Sorry. Oh, go on, Brian, go.
And it's got nothing to do with any of this, but it's just for my own benefit. You said when the young lady left, they gave you the job, or separated bits and pieces up. Was that a budgetary decision? Or was it because it was halfway through the term and they thought a new person would have difficulty in picking everything up for the term?
No, it was, well, I suppose you could call it a budgetary decision for the ICB, because they had made a decision previously that all posts were frozen, because they were going into and it is part of a national consultation. Yeah. And so every single ICB, Integrated Care Board in the country, has got to lose 30% of staff, as have, interestingly, OHID, Office of Health Improvement Disparities, so it's the national bit, and also NHSE have got to lose 30%. So all three organisations, from national to national, regional, local, have all got to lose 30%. And it's a NHS requirement that if you are going to make that level, well, go into that process, you then have to freeze all recruitment. So it therefore becomes, I suppose, budgetary.
Yeah, I think it worries me a lot, but I hate seeing the recruitment stopped. Which brings me on to just one quick question. I think Andy can answer this. As you probably some of you know, I'm chair, or was chair, for the children's, right? And things I wanted to have done, or I thought would be beneficial to our children to have done, they're saying, oh, it comes under budget, budget won't allow this, won't allow that. And I understand budgets. I've been in business all my life, so I do understand budgets. But is, say, your budget, for argument's sake, does that include the children's side, or is the children's, our children in care, is that completely separate from you? So, yes, please. Thank you, Andy.
Thank you, Councillor. No, so the way that the council currently delineates its budgets, adult social care deals solely with those people who are either over 18 or who will be turning 18 and may need support after their 18th birthday. So currently those two budgets are managed in different directorates. So
it's your fault. Because basically the the people that I was concerned about, because we keep them up to 25, don't we? They're our responsibility up to 25. And it was those 18 to 25s that I think who have suffered a hell of a lot of trauma in their lives, I think need more education from the people who are looking after them. And South Downs College agreed with me on it. They said their teachers should be educated better with the 18 to 25s who come into them. So really that does come under your budget or it doesn't?
It very much depends. So the two distinct pieces of legislation are the Children Act and the Care Act. So the Care Act tends to apply to adults, Children Act understandably applies to children, but there are provisions within the legislation that maintain an element of responsibility for someone who's been a child or a young person past 18. So that 18 to 25 very much depends on the needs that those individuals have as to whether it sits with adults or children. But what we can do is we can have an offline discussion and work through some of those, and I can give you a lot more information.
Thank you very much. Thank you, Chair.
Thank you, Brian. I'm sorry I missed your hand up there. Just on the structure thing that you asked Helen about. So when Joe went, so the structure was all agreed with the consultation of Natalie as chief executive, because obviously she had real concerns that this would be basically a load of stuff put on to Helen. Helen is our Director of Public Health. She has a lot of work to do as Director of Public Health, and this was additional. So to make sure that this was not long term, this was time bound, and to make sure that there was proper support around there, and that obviously, but also there was a proper hierarchy of responsibility as well. So that's what very much so from the very beginning, Natalie was very, very robust to say this is not long term, this cannot be long term. There needs to be a solution that is long term, that needs to be, obviously, it's your budget as well, because remember, Helen is paid for by us, by the council, and effectively we're doing a bit of work for the NHS, to be honest. And so that's why it can only be interim, and so we are hopeful. So that's why it does sound like there's some sensible news in terms of how they're approaching it from a place-based point of view. But the problem is that, and this again, I said this in my feedback to the Integrated Care Board, the way they've done their what's called it's the Mars, isn't it? That's referenced in the paper. Of the way they've given redundancy has been completely haphazard. So we've lost our place director. In Southampton, they've lost all their finance staff. There was no plan to it, and so that's why you've found yourself in this really difficult situation. So hopefully, once they've done this restructure, there will be a much more sensible approach. Other authorities, other parts of the NHS have got to get rid of this staff. They haven't done it in such a haphazard way, and really that's been very poorly managed. So we are hopeful now that they will have, when the structure comes out, it will make sense and it will actually facilitate local delivery rather than leaving gaps all over the place, which is what we've got at the moment. So I think that's worth saying. But because if they said no, it's going to go on forever, we'll go, well, we just can't do it. You'll have to find another solution, and that's it's not a great place to be. So I will conclude that now. So thank you very much for this municipal year, and I will see councillors' colleagues tomorrow at full council.